As the whole world moves online, we're seeing health organisations utilising digital technology more and more. And a lot of the innovation in this digital space is being led out of Europe and North America. For example, hospitals in Canada now are being built with a digital interface between the patient's rooms and the nurse's station, which cuts down on nurses' walking time between the wards. Some really cool, innovative stuff. That innovation is really being led abroad. We're not seeing a lot of world-leading innovation happening in the Asia region. There's opportunity then for health organisations in Asia to be the first to look around the world and see what's available and then import the best and apply it in the local market. We're definitely seeing an increased adoption of digital technology to not just do medicine, but also to communicate medicine. And this need to communicate has really sprung out of the move towards a preventative approach rather than curative medicine. So more and more health organisations and hospitals and health promotion bodies are coming to agencies like Shandwick to help them really attack their communications campaign and get on top of their public health promotion plans and to reach a larger audience with digital technology. So digital technology is helping hospitals and health promotion bodies communicate on multiple fronts. On the PR front, we're seeing a lot more active engagement between hospitals and patients. Hospitals and health promotion bodies are now competing for attention against some really slick campaigns coming out of other sectors. So for example, every time you have a campaign telling you to eat healthy food, there's a campaign that advertises junk food. So health organisations are really having to lift their standards if they want to be effective in bringing about attitudinal change, behaviour change, and just getting noticed. Obviously in health, budgets are always an issue, so you're seeing more of a swing towards employing digital media to reach larger audiences in a more effective, cost-effective way. Health promotion organisations have really gotten on board social media in some ways, so they're often the first to use Facebook, Twitter and blogs, anything that's free and available. But where some really innovative campaigns are happening is often in special interest areas. For example, we had a video campaign that came out of the UK which linked malaria to the vampire craze, and they made some really cool online videos targeted to teens. And that was a really great way of leveraging the teen market to get mobilised behind fighting malaria. The Cancer Council in Australia developed a mobile app which read the UV rays and gave them the risk factor for that day. A great leader in the digital space is Movember, who have gamified fundraising for the whole month of November. And they're utilising not just Facebook and Twitter, but they're also crowdsourcing great content with tools like Flickr and Pinterest. And they're using videos to share patient stories, and they've built mobile apps to encourage conversation. So they've got a really good combined and integrated digital approach. Digital offers amazing opportunities for government, for hospitals, for pharmaceutical companies, for support organisations and all aspects of public health. In Asia, the medical industry is really lagging behind the US when it comes to self-promotion online, despite having a huge amount of medical tourism in this region. The US medical industry has always been really proactive about promoting their services online, and I think that in Asia, particularly for private healthcare providers, plastic surgeons, cosmetic surgeons, dental clinics, they could do a much better job of being proactive about self-promotion. And that means creating some really fantastic content, having a website that's very modern and engages with people directly, and it's really open about the amount of services and what you can provide for your patients and consumers.